Hello, how are you? My name is Paula Restrepo, owner of Guapo Pets Domini Pet Spa. This time we are going to talk about gastric torsion or dilatation. This pathology is presented by the accumulation of gases in the stomach. It can be produced by bad eating habits. Normally this disease is very progressive. It is necessary to act urgently in order not to cause the death of our pet or to have problems in the future. A very important factor can be presented. It is due to the stress that generates the puppy at the time of eating. This can be avoided with, well, in special anti-stress containers that bring something in shape for them to make it more difficult for them to eat. We can also say that feeding is very important that our puppies do not make excessive exercise, because this can make the stomach turn around and generate gastric torsion obstructing the intestine and stomach. This can be very painful for them, so it is very easy to detect. Gastric dilatation or traction is caused by the accumulation of gases that are retained in the stomach and can generate a dilatation or swelling in the stomach, making them unable to make a good digestion. It is very easy to detect. Normally they will begin to pant and have problems with breathing. They will begin to become a position in which they will look at their sides, as if they were in pain. It will be very easy to know that the dog is going through something. When we present or see these symptoms in the pet at once, it is important to take it to the doctor so that the veterinarian takes a chest and abdominal X-ray to see what is happening with the pet. When we take our pet to the veterinarian, he will act very quickly and timely. Usually surgery is done by a laparoscopy in which we will accommodate the stomach in its normal position.
Sacando todos los gases acumulados en el estómago, haciendo también una fijación del estómago en la cavidad abdominal para evitar que esto se vuelva a presentar a futuro.
Gastric torsion occurs because the thoracic cavity of the puppies is very deep. It happens initially in large breeds, such as the Irish Setter, the Saint Bernard,
labrador, pastor alemán, golden, en perritos grandes. Puede también pasar en perros pequeños.
It can also happen in small dogs, but normally it is in big breeds. Since their thoracic cavity is much bigger, then the organs will not make pressure in the stomach and it will have much more space to be able to change position. After this surgery, it is also important to be very careful. As I said before, with the feeding, do not give late meals, suddenly. Heavy food for the puppy that can generate a lot of gases. Avoid only one meal a day. It is always advisable to give in two portions to avoid bad digestion. It is also important to always give the food together with water to accelerate the metabolism. The care with is not to force them to, suddenly, an excessive exercise after the feeding to avoid that the stomach dilates. If this disease is not detected in time, we can cause the death of the puppy because the organs will run out of oxygen. When they run out of oxygen, they will obviously not work well and can cause death. We can also strangle the stomach. We can generate a peritonitis in case the stomach is strangled. Breathing can also be crucial. We can see the respiratory system affected. Can also generate a cardiac arrhythmia. The kidneys can stop working. So it is very important as soon as we see all these warning signs to take him to the veterinarian to avoid problems and complications in the future. Normally this pathology can occur in the future if the eating habits are not changed, if the aforementioned care is not taken. But with the surgery today it will be very well because a stomach fixation will be done in the abdominal cavity to avoid this in the future. It should be said that this occurs mainly in large breeds, but it can also occur in puppies. They eat with much more anxiety and are a little more restless when eating, so this can also generate this gastric torsion. We can say that due to a bad ingestion they can suddenly eat or enter the stomach inedible elements, and they can generate a gastric obstruction that can also generate the torsion. So always be very aware of what they eat and what our pets do. As a first sign, as we already know, they can retch, which are suddenly the desire to vomit but without any result, abdominal pain, panting, stress, pain. They will be lying down as if they do not want to stop. So when we see all these warning signs, please take them to the veterinarian. It is also important, as I have indicated, to take him quickly to the doctor so that he can act immediately, because this can generate problems in the vessel, mainly due to the irrigation of the blood vessels that can be obstructed and can cause very strong hemorrhages or the obstruction of blood, thus damaging our organs. If this is not done in time, the puppy can die. Normally from 5 to 15% of the puppies die from this pathology. In surgery is not very complicated, if it is attended in time. Then as a conclusion, how to avoid this problem. Giving a good intake of food, rational with time, at hours so they have a good digestion. Provide good water. Avoid extreme sports so they will not damage the stomach. Also avoid heavy meals. How to detect? By the strong pains. This is in the puppy in retching. And after the treatment, be very careful with the already mentioned in the feeding. Give the analgesics and medicines prescribed by your veterinarian. Also avoid infections in the surgery. Have a lot of asepsis and be very strict at the time of feeding. That is basically. I say goodbye to you. Remember to follow us on our social networks. You can find us at Guapo Pets on Instagram and Facebook, and on WhatsApp you can write us if you have any questions. Be very well.